Are you wanting to retire early before the age of 65 but feel stuck because of the high cost of healthcare? Well, let's talk about 4 options that you may have available to you that might help you make this decision to your advantage. And one of the options, Jason, is what's called COBRA. Okay, so COBRA is a continuation plan, which basically allows you to continue your current employer-based healthcare after you retire. It allows you to literally, the day you retire, start coverage at that point moving forward. And it's the same plan because it basically is an extension of the existing plan you have for up to an additional 18 months. Okay, so this is an option to you. Pros and cons of this. The pros is pretty seamless. It's offered by most employer plans, and you just literally have to fill out an application and away you go. Okay, the con of this is usually it's very expensive. It's more expensive than what you're used to paying because the plan itself is usually subsidized by your employer while you're working. But the moment you retire, now you're responsible for the full cost, and now you actually see what the employer is covering for you. So it can be kind of costly. And if you're retiring in your 50s or 60 years old, I've seen plans go up to $1,000 for family, more than $1,000 for family. So it's available to you, but you have to see what your plan looks like and see if it makes sense in your particular situation. So another option that might make sense for you is the possibility of going on a spouse's plan. Now, this only makes sense if both spouses don't retire at the same time and you have a spouse that continues to work, okay? Maybe they just love working or they're younger or any of the above, okay? But if that's the case, there may be the possibility of you joining that plan that the employer offers, that the spouse's employer offers. Sometimes this makes sense because it's pretty easy. It is a qualifying event, so you can do that anytime. When you retire, it's called a qualifying event. You can join that spouse's plan. So the ease of it makes it an option, okay? However, sometimes it may not make sense because it could be expensive. The employer typically is only required to pay part of the employees, not necessarily the family's premium. So this could get as expensive as COBRA, okay? So it may or may not make sense. You have to look at particular coverage for your spouse's employer-based plan. And if it doesn't make sense, then there may be some other options which we're about to cover. I mean, maybe just do COBRA as we mentioned, but you might also consider one of these other options, such as a healthcare sharing plan. Jason, talk to us about healthcare sharing plans.
Yeah, so with the healthcare sharing plan, it's actually not considered insurance. So it's legally they can't call it health insurance, but sometimes it's called healthcare sharing, medical sharing. But basically, these are nonprofit organizations that pool together a bunch of funds. So a bunch of people that are paying in premiums, even though they're not called premiums, paying in share amounts into a pool of money. And then from that pool of money, all the participants who are contributing, who are part of that health insurance plan, can then use that money, or the organization uses that money to pay for their medical expenses. So it may not be appropriate for everyone because you have to kind of fit under a number of criteria to even qualify. Some of them, you have to be part of a religious institution. There may be some area that you have to qualify to even get into it. So you have to look at the different options there. The other problem with these type of plans is that they don't cover pre-existing conditions. So if you have a pre-existing condition, this is probably not a good option. But if you are healthy and you do qualify under one of the different institutions, this could be a way that you could really save a significant amount of money. But it is a little bit complicated and people don't really understand it. So we may do another video on this one to kind of give a little bit more options, go into more detail.
So we've talked about COBRA. We've talked about going on your spouse's plan, if that makes sense. We've talked about healthcare sharing. Another and fourth option, I think, is the consideration of just the marketplace plans, right? Because if you retire technically, typically, your income might be lower, okay, than when you were working. So now you may be able to qualify for a subsidy on, under the Affordable Care Act, under one of the marketplace plans. So how does that work? How does that work, Jason?
Yeah, so in order to get a subsidy, you can't have your income too high. So the way to do that, and we'll get into an example here in a bit, but basically from a high level, you have to lower your income so that you can qualify for these subsidies. So there's different, and we'll show you a scale on this next slide here, but there's different increments in terms of how much of a subsidy you'll receive based off of the income that you're taking.
Right. Now, naturally, if you stop working, your income typically goes down anyway.
Right.
So there may not be anything for you to do because you just qualified just by the nature of you're retired and you're making less money.
Yeah.
But that may not be the case.
Right. So if you don't make any money, then lower than a certain amount, you would qualify for Medicaid.
Right.
But that is usually not the option that most people want to be on as Medicaid.
Right.
So in order to get onto Affordable Care Act, you need to make a certain amount, above a certain amount, but then in order to get a subsidy, you need to stay below too much money. So you can see on this slide, you have two different tables. The table on the top covers basically the percentage of your what they call the federal poverty level, FPL. So the percentage of FPL, now you have to be at 150% of the FPL to qualify for the ACA, the Affordable Care Act, the subsidy, right? And then, but you have to be below the 400%. And you can see the different increments here based on your household size. Now, the other thing, if you look at this bottom table, the bottom table is showing what percentage of your income you're going to pay based off of the amount of taxable income that you are receiving for that given year. All right, so let's look at this example of Julie and Carlos. So they're 5 years away from 65. So they're 60 years old. They just retired, and they have to find a way to cover their health insurance from age 60 to age 65.
Because that's when Medicare kicks in.
That's when Medicare kicks in at 65. So they have to find that solution. They no longer have their health insurance from the work, and so now they have to find a solution. So their cost of living per year is around $75,000. So a lot of times what happens, as you see on this next slide, that a couple may have just saved in their 401ks, and they've built up these 401ks and at retirement, now they roll those over into IRAs. And when they go to take that money out, all of that money that you pull out of an IRA is taxable income. So if they funded all of their living expenses, the $75,000 just from their IRAs, then they're going to have $75,000 in taxable income. Well, as you can see on this chart, at $75,000 in income, they only qualify at the lowest level of subsidy. Right. So their healthcare expenses would be approximately $531.
Right.
However, let's say they did some planning before they retired and they built up money, not just in their 401k, but they built up money into a Roth IRA or even what's called a non-qualified or a non-retirement investment account. Or they just had some savings in a bank account. Right. So they have money outside of a 401k. In that scenario, you could, instead of taking the money out of your 401k or all of it out of your 401k, you could take money from your Roth IRA, or you could take money out of your savings and investments that are not in retirement accounts. If you were to do that and pull out $30,000 from your traditional IRA, which came from your 401k, but the rest of it, you take the rest of the $45,000 to cover your living expenses would come from either a Roth or your savings, your non-retirement accounts, then that could lower your income significantly. And in that scenario, you would only pay 0 to 2% of your income for the year, which is around $125 a month. So from that standpoint, by doing those that strategy, by utilizing that strategy, you save over $400 a month, which is close to $5,000 a year.
So again, every scenario varies depending on your particular circumstances, how far away you are from retirement, what you're able to save and create as a portfolio. But hopefully this is something for you to consider that is helpful. And if it is, please hit the subscribe button, and we hope to see you soon.